Hi, I'm Tyler Nix. I'm an informationist at the Taubman Health Sciences Library. And I am one of the informationists who works with the College of Dentistry and Dental Hygiene. And I also work closely with the emergency department. So it's good to see a few familiar faces here. And we're happy to be here presenting today. And I want to turn it over to my colleague, Caroline, who will introduce herself.
Hi, I'm Carolyn Keiko. I'm the Map and Geospatial Data Librarian up at the Clark Library on the Patcher at the main Ann Arbor campus. We do a lot of geo data help to the entire campus. I get all sorts of interesting questions all the time. And I also help people when we're in the physical location find like paper maps that we have.
Great. Okay, thanks, Carolyn. Sorry. Okay, so this is just a brief overview of what we're going to cover in the session today. Again, we're happy to be here talking to you about GIS tools and geospatial data, geocoding. So we're going to do a mix of talking about some tools and data, and then also do a live demo so that you get a sense for a couple of processes that you might find useful in terms of simple ways to go about mapping addresses or finding latitude and longitude for known locations that you might already have in mind. And just so that we're all on the same page, for today's purposes, we're defining geocoding as just converting street addresses into coordinates for mapping. So we're going to take some street addresses and drop them straight into a map. We're not actually going to convert them over to like latitude and longitude, but that's what we mean by geocoding. And we're referring to geospatial data for today very generically. So really just any data that has a location component. So that could be an address or a zip code, a city, state. So that's that little bit of housekeeping. And please stop us at any time for questions. We'll keep an eye on the chat and we can answer questions as we go. We'll also have time for Q&A at the end. So either jump in or wait until the end, totally up to you. And we plan to cover kind of a lot of ground today. We're going to look broadly at some things that may be of interest to you. So you'll have the video after the fact and the links that we're going to cover here. So just a note for that as well, just a little bit of housekeeping. Okay, so before we really get into any sort of detail in looking at tools or data or anything like that, I just wanted to take a minute to sort of frame the context of this presentation in terms of looking broadly at ways that GIS and geospatial data may be useful to you in your work and in your research, and would be happy to hear from you today in the chat or in the Q&A if there are specific things that you're working on that you want to share. So the use of mapping and considering spatial data in public health especially goes back a long way in terms of looking for patterns that connect people and place and the economy and the environment with factors having to do with their well-being. And a really famous example that you may have heard about before was that in 1854, John Snow, I think he was an epidemiologist, I don't remember his exact role, but he drew a hand-drawn map of London and used a map to help sort of isolate a cholera outbreak to a particular water pump. And so that's just one of countless examples that if you're interested in the history, you can go look that up. But there could be really a lot of ways that GIS could apply to your context in your work. And that could be things like public health researchers who are wanting to understand community environments to inform healthcare policy or service frameworks. That could be better understanding chronic conditions in the service area where you work. It may also be something like the example that's on the map on this slide. This is from a 2017 study by some emergency medicine physicians at Harvard and Mass General in Boston. And they basically analyzed their own patient data around opioid overdoses to try and get a sense for where, if anywhere within Boston, opioid overdoses may be concentrated. And they ended up finding really concentrated rates in this particular neighborhood. And they mapped this in the hopes that they could potentially encourage the redistributing of existing resources more efficiently and helping providers and patient advocates within this part of the community be most effective. So that's just a sort of a really brief look at the context of why we're talking about this today. And I'm sure you all have, thoughts how this may relate to your work. So with that, I'm going to turn it over to Carolyn, and she's going to walk you through just some of the software that's available here that you may be interested in using.
Thank you, Tyler. I'm going to take over with my screen. There we go. Okay. So in order to keep this sort of as simple as possible, I'm going to group like two sort of ways of analyzing and accessing data. There are the tools for exploring geospatial data, which are on this slide, and these are the tools that already have data in them. You don't have to download any new software. You don't even have to download the data. You can just look at it here. And the next slide that I'll show you would be tools that you yourself download and you conduct your own analysis with your own data that you've sourced from somewhere else, which we'll talk about how to find later. But that's kind of the distinction. Stuff that already has data in it and stuff that doesn't. So I know a lot of people are often looking for census data, and you might have previously suffered through American Fact Finder, which no longer exists as of April 1st, 2020. There's a new data.census.gov website, which is a lot better. It still has some glitches, but you can use it to find your census tables and download them that way. I still prefer Social Explorer because it has things that aren't just the census. So it's repackaged census data, but it also has other stuff, which we pay for. So these links here all link to the University of Michigan sort of affiliated links that we pay for. So make sure that you are using these. They all have free versions, but if if you can have the premium version, then please use that. So on the right, you can see a screenshot of Social Explorer, which I will go into in a minute. And you can see sort of the layout. Like I zoomed in on Michigan, I selected obese persons 20 years and over, and you can see the legend in the bottom left sort of shows you, on a percentage scale. And in the bottom left, that's policy map. And I picked the variable of life expectancy. Social Explorer and policy map have a lot of overlap. So if you're looking for something specific, you'll want to check both. They both contain census data, they both contain health-related data, but the specifics might differ. So you can see on the left, there's life expectancy, and you can see the legend in the bottom left as well. Cardo is kind of a special case, but it's often used because it's pretty easy. It's web-based, you don't download anything, and it's often used for timeline visualizations. The important thing with Cardo here is when you click that link, it takes you to umichigan.cardo/signup. And if you don't sign up through the UMichigan link, you will not get the UMichigan benefits with your account. And you would have to contact Cardo and have them change it on the administrative side to be part of our organization. So if you need any help with that, please email me if you end up using Cardo. Okay, so now I will open up Social Explorer just to give a brief a brief demo of kind of its power, what I like about Social Explorer. So this is the catalog record, and the reason I'm sending you here is so that it forces you to go through this paid link that we have. And you can see professional plan provided by the University of Michigan. We're on the Explore Maps tab, and if you scroll, you can see some pre-made maps. So for example, we have US COVID-19 data, which I'm sure everyone would want to look at. If you keep scrolling, there's US health data, and this is the one that I took that obesity data set from in the screenshot. And this is just kind of a collection. It says it's from the County Health Rankings and Roadmaps program. So that's not the census, that's an additional data set that they've put into Social Explorer. But if you just go to this generic one at the top for the whole United States, then you click Explore, and it takes you to this main page. The first thing that you see on this main page is always population density per square mile, and it's from the American Community Survey 2018 5-year estimates. As you zoom on the interactive map, the geographies get smaller. They get, like finer grained. So now it's on county. Previously it was on state. Now it's on county. If you keep zooming, you can set it to, I want to look at census tracts. I want it even more fine grained. And you'll only get the option to change the geography level if the geography level already exists with the data that's there. The other helpful thing, so this is all, for browsing. If you hover over it, it'll tell you the population density for that particular census tract in which county and what the total population is. The other useful thing here is if you do this map view thing and you do side by side, you get two maps. So right now I have population density and population density, which is the same thing. So why don't we change to something else? And you can see that it's default on 2018 because that was the American Community Survey 2018 that the population density came from. But if you scroll all the way down past these data categories, these are the data categories that exist for 2018. If you scroll further down, you can get ones that are not available for selected year. Obviously, there's no COVID-19 data for 2018. But if you click that year, it automatically jumps you to where the data does exist. So for example, that obesity data, I think was 2016 only. So if I tried to match it in 2018, it wouldn't exist. I'd have to scroll down and it would tell me, oh, we have it, but we only have it for 2016.
Carolyn?
So, yes?
Real quick, hopefully you were going to address this, but we do have a question from Rama. She's wondering if the data can be downloaded from Social Explorer.
Yes, it can be. It's mostly downloaded as tables, but you can also get shapefiles. I'll show you where in a minute. Downloading stuff gets a little dicey. So I recommend this mostly for people who want to browse things. But it is possible to download all of this. Okay. So this comparison is really useful because they are locked together. So if I want to zoom in on Wayne County, if I hover over, even on the right side where it's cumulative number of confirmed cases, it'll tell me, it says Wayne County when I hover over it, it says how many cases, and then underneath there's the part that says second map, and it tells you the corresponding data for that county from the other map. So this is a really, really useful tool if you just kind of want to, if you want to explore. This is, Social Explorer. This is what it's my favorite for. If we go back to our dashboard, so when you want to download things, you have to go to this tables view. And this is where it lets you pick like, oh, I want to download from the American Community Survey, and then you begin a report. I won't go into it too much, but essentially it makes you select, it keeps going like hierarchically down for what you want to select to download. And these are tables only. If you want shape files, so we were on the Explore Maps tab, tables is where you download from. And then there's also this geodata page, which is brand new. I recommend it. I have used it. They give you their own versions of census, zip code tabulation areas, census block groups, congressional districts. And this is where you can download the shapefile. So if you get your shapefile for census block groups and you download a table that also has census block groups, you can join them together. So hopefully that answers your question. Although the joining of those could be an entire separate presentation, so I won't go too far into that. Okay, so that was Social Explorer, which is my favorite tool for things that already contain data. For things that don't already contain data, we primarily have the Esri suite. It is sort of the proprietary software in the GIS field. It's Windows only, which is a problem for a lot of people. Although at the University of Michigan, you can use a virtual machine to get into a computer on campus that has ArcGIS installed already. It is slow, and we actually had a lot of problems at the beginning of COVID of people, like it would crash and then people would lose what they were working on. So that's kind of the, you know, the warning with virtual machines, although it's apparently working a lot better now. So the Esri suite includes ArcGIS Pro and ArcGIS Desktop. ArcGIS Pro is the new one. ArcGIS Desktop is being phased out over the next several years. And those are the ones that you download onto your computer, and it's your software on your computer. It's big, and it's, you know, it can do a lot. It's really powerful. The next one is ArcGIS Online, which Tyler's going to be showing. It's browser-based. You can access it on your Mac. I have a lot of people who use ArcGIS Online. It has limited analysis capabilities, but it sort of covers the bases. So I really recommend ArcGIS Online. It's quite easy to use. It only gives you like 6 or 7 analysis options. Then there's Story Maps, which builds on top of ArcGIS Online, but it's more of an outreach tool. So you can use it to sort of tell a story. That's where they're going with that one. So I have this example here made by the Esri team, very meta. It's a story map about uses of story maps during the pandemic. So as you scroll, it's kind of a nice little web page, and it has links to other things. You can see that the sidebar moves while the map is moving on the other side. And if you create a story map, you're in control of how that map is moving, how the reader is seeing it. And it also lets you just put a map for someone to explore on the web without you having to sort of choreograph how it's going to go. We also have ArcGIS dashboards, like the infamous Johns Hopkins COVID one that we have all been looking at over the last several months. So this is built on top of ArcGIS. This one, it's taking a while to load, but I think everyone knows what I'm talking about. So this is all built with ArcGIS dashboards. And if you are not a Windows person and you're not using Esri, then we have QGIS, or some people call it QGIS. It does not matter. It is free, it is open source, and it's Windows, Mac, and Linux. It has gotten so much better even in just the last few years. Like, it's great to use. It can do pretty much everything that Esri can. The benefit of Esri is kind of the integration of all the things. Like, you can put something in Pro and then move it to online and then move it to story maps, yada, yada, yada. But we support both Esri products and QGIS at the Clark Library. Finally, I will say everyone who's affiliated with the University of Michigan has an ArcGIS Online account. You have to make sure that you go to the UMich Maps ArcGIS link, not just the regular ArcGIS Online page. Like, if you Google ArcGIS Online, that won't get you anywhere. When you get on that link, you sign in at the top right. It should automatically send you to the single sign-on with your unique name and your password. And this is both done to log into your ArcGIS Online for the first time, but also to sort of authenticate the license if you're going to be downloading ArcGIS Pro. So that's why that's important. I'll hand it back to Tyler for his demo.
Great. Okay. So hopefully, are you seeing my ArcGIS Online now?
Yes.
Okay, good deal. So let me get resituated just a little bit. Okay, so we're going to spend the next few minutes now working in ArcGIS Online, just to take a really simple set of address data and to get a look at how easy it is just to map that. So if you have already signed in from Caroline's slide, as you saw, when you first get to this link, there's typically a sign in option in the top right. And once you sign in, you get some options across the top nav bar here. So I'm going to click on Map. And that's just going to bring up sort of the basic starting point to start a map in ArcGIS Online. And before I start the map, I want to also take a quick moment to just to show you briefly the data that I'm going to use and what the data looks like and how easy it is to get a simple data set in a CSV file and work with that. So this is a list of substance use disorder clinics in Washtenaw County. I got this list and kind of modified it to simplify it from a resource that Carolyn's going to talk to us about in a few minutes. It's the Big Ten Academic Alliance GeoPortal, and it has lots of health data for Michigan and other Midwestern states. So I found this substance use disorder clinic list. And all we're looking at here is just a few columns. We have a column for the name of the clinic, the street address, city, state, zip, and county. And there's about 32 clinics in this list. One thing to keep in mind working with Esri products and others as well is sometimes mapping software doesn't like for there to be gaps in your column headers. So you see here with street address, I've just combined those, or you could also maybe put an underscore there. Another thing to keep in mind if you're gathering data to potentially use it in ArcGIS Online, you want to save your Excel data into a .csv file because this program is going to read CSV files, but not Excel files. XLS. And my computer is freezing up a little bit. Hopefully. Okay, hopefully I'm live. My computer was freezing up a bit, so I'm going to forge ahead. So this is what the data looks like that I'm about to map, and it can be as simple as this. There's a couple of ways to get started to create your map. If you have your Windows Explorer or wherever your file lives on your computer, if you have that available, you can just drag the file straight into the mapping interface here. I'm actually going to go and do it a different way, slightly more complicated, and click on Add Layer from File. And I'm going to choose the file that we were just looking at. And when I click Import Layer, there's one thing to sort of make sure you keep an eye on here. So while we're adding this layer, ArcGIS Online is basically looking at our data and trying to sort of make sure that it's interpreting it correctly. And we have the street address field here. And basically what we want to tell the software is that for our street address field, we want ArcGIS Online to read that as an address or a place. So having done that, the default suggestion, we now see it may be a little bit hard to see because of the formatting right now, but the software has mapped all of our clinics. But the default suggestion for mapping for the symbology is to give each of these clinics its own sort of color with a little circle dot. And I'm not really a fan of that. We can only see the first 10 or 12, and all the rest of our clinics are listed as others, and it's just not displaying really like I want it to. So instead of looking at unique symbols, I'm going to click this single symbol option, and that's going to display everything just uniformly as its own symbol, but all the same and not uniquely. And there's a ton of customization you can do from here. I'm not going to go too in depth, but if you wanted to change the symbol itself and make it larger, there's a lot of options that you could do from here sort of to work with the data. But that is a very, simple, easy way to just take some points of interest that you have addresses for and get them on a map to where you can use them in some different contexts. So I'm not seeing any questions about that. If there are no questions, I'm going to move on and show one other thing that may be helpful. So this is good, obviously, to use in a case where you already have a list of addresses, but there may be times when you know where something is, but you don't have an address for it, or you don't know the latitude and longitude for it. And you need to go about finding that data, and maybe you can't find it in any of the traditional ways or ways that have worked for you before. So one way you can do that is to pull up Google Maps, and it seems like this works best in Chrome. I was not able to do what I'm about to do in Firefox. I'm not sure how it works with Safari and some of the others, but I would recommend using Chrome if you can. So let's say, so I'm going to pick just a very random example and go to Escanaba, and I hope I'm pronouncing that correctly because I'm not a Michigander, so please, someone correct me if I'm wrong. But let's say you're mapping substance abuse clinics in the UP, and you know, and yes, Rama says I pronounced it correctly, thank you. And you know where a clinic is, then you could just navigate to where you want to go. So let's say maybe you know that there's a clinic somewhere at Bay College. You don't know specifically where it is on campus, but you know it's in this vicinity. So you can kind of pick your middle point and right click, and that will, the first option in this menu is going to give you latitude and longitude coordinates, which if you click on them, just a single click, then we get a little notification down here that that information has been copied to our clipboard. So if you're starting to collect that data, you're putting it into an Excel file or wherever it is, then that can be a way that you can start to build out your data. This can be a good process if you want to generalize an area. So in that example, if you know there's a clinic at Bay College, but you don't know specifically where, you could kind of pick a middle point. Similarly, if you're working with a vulnerable community, that could be a way to centralize a point within a community without really, picking any specific point if you don't want to. And obviously, it can also be really helpful if you don't know the address of a location, especially if you're looking for locations internationally where you're not familiar with how the address systems work and things like that. So I don't see any other questions. So that's the beginning. That's the end of that, of the hands-on. And I'm going to pass it back to Carolyn at this point, who's going to talk to you a little bit more about data sources and where you can find data.
Thank you, Tyler. I'll take the screen sharing back. Here we go. So as far as finding geospatial data, you can get things from portals like how Tyler mentioned, which I will talk about on the next slide. So those are kind of they're all collected in one place and they're from a certain authority. But if you don't necessarily know which authority has put out the data that you're looking for, like if you don't know the specific names of the organizations that might have the data you're looking for, and if you don't know anything about the area, this is the big one. I am from Canada, I'm not from the States. So when I was looking for any kind of data in America for places that I've never been and I'm not really familiar with, then I have to start Googling. So keywords such as GIS, spatial, shapefile, and TIFF, which are two file formats I'll address in a minute, and the name of the city, state, county, or the government department, such as like Department of Natural Resources, Department of Transportation, plus the words open data or data portal or open data portal will usually sort of get you in the right direction. So if you type in Michigan shapefile roads open data, then you'll probably end up at like the state of Michigan's portal, looking for the road shapefile that they have put out. So that's kind of, it's using the specific words, because if you just type in like geographic, I don't know, like if you didn't use the word shapefile, you might not specifically get what you're looking for. So speaking of shapefiles, they are the vector format that is most commonly used in Esri products and in QGIS. It is a shapefile is a point, a line, or a polygon. They are they also have tables, like attribute tables, that have data about that specific polygon. So if you got all of Michigan like we had on Social Explorer, each one of those counties is a polygon and each one of them has attributes. And in the case of the population density one, the attribute was population density per county, and there was also per census tract. So those are all different geographies, and those are all stored as shapefiles. And that's what's downloadable through the Social Explorer Geodata beta that I showed earlier. The second format you will most likely never use. Raster formats most commonly are stored as TIFFs, and that's aerial imagery, satellite imagery, and drone imagery. You might end up using drones, but probably to collect points or lines rather than to take aerial imagery. Health-related applications where you might need aerial imagery, but it's unlikely. I'm just telling you what that is so that if you come across raster or TIFF, you know that that's probably not what you're looking for. And the third one is tabular data, which is not inherently spatial, but it's what Tyler had. It's your table, it's your Excel file, or your CSV. If you're using ArcGIS Online, it's only a CSV. And it can be joined to those county files, for example, to add more data to the attributes. So if you want, you know, more than just the population density in that Social Explorer, then you could, you know, based on that county ID or based on the census tract ID or census block group ID, you can join extra tables. You've probably all most commonly worked with tabular data to run statistics. So you never need to open GIS software for that. You would only need it if you wanted to put the tables into a map by joining them to a shapefile, which I could also spend an entire talk just about joining data. So if that's what you end up wanting to do, feel free to reach out. So the important thing here is that different data types will work with different tools. So that's kind of why I'm trying to give this overview here. Like a KMZ file for Google Earth will not play nicely with anything you get from Social Explorer. And if you tried to put a shapefile into Google Earth, it wouldn't even do anything. So it's just important things to keep in mind. And here are my sort of recommendations for data sources if you're doing local research. So in the bottom left, you see the screenshot of the Big Ten GeoPortal. And on the bottom right is the Michigan Open Data. So the important thing about the Big Ten GeoPortal is that it's sort of the one-stop shop. Librarians from all the institutions in the Big Ten work together to put our state's data into the portal. So we have myself and my colleague Nicole are on the Big Ten GeoPortal for the University of Michigan, and we also have someone from MSU. So between all of us, we've put in links from, and it always links out to the source. So the Michigan Open Data that you see on the bottom right, all of that is in the Big Ten GeoPortal. And you could find Washtenaw County Open Data, and you could find the Ann Arbor City Open Data. You can find all of that in the GeoPortal. So if you type in roads, you'll like roads Ann Arbor, you'll get results from the Ann Arbor, Washtenaw County, and the state of Michigan. So that's kind of the one-stop shop, and it's for all the Midwest states. You can find COVID data there. We've been putting that in since April. The problem with the Michigan COVID data is that it was not as interactive or downloadable as some of the other states' open data when we were putting into the portal. The key thing with the Michigan Public Health GIS is that you can browse by the tag. So everything, you know, if you search for public health, then you can get healthcare, and you can see that they're all coming from different sources. This is Forest Health, so that's not what we're looking for, but you can see it came from the Department of Natural Resources. If you scroll further down, there's the COVID-19 from the Department of Transportation, and see that's just a link to the michigan.gov because there was no data that we could actually download to put into the portal. And there's also the substance abuse clinics, I think, show up. Substance use disorder care shows up as a feature layer. Yeah, but there's sort of a lot to go through here, and this is just one option for Michigan data. The GeoPortal, I will quickly show, is useful that you can search by keyword. You can also search whether you want like the category of geospatial data, maps, or aerial imagery. You can also search on the map, which is my favorite, because if you zoom in and you only want to look at, but you want to look at more than just Ann Arbor or more than just Washtenaw County, but not quite the entire state of Michigan, you could just kind of zoom into an area, and you can just say search here. And it'll tell you everything that was within the bounding box that you just viewed. So it included part of Ohio, apparently. But yeah, so that's kind of, the easiest way to search when you don't really know what you're looking for and you kind of just want to see what's out there. But if I wanted to type in COVID, I could type in COVID at the top and it would, oh, it's going slowly. Oh, so I'd have to clear my previous search because it counted that bounding box. That's important to look for. But if you just want to see all the COVID dashboards, then they're all here. So it's a very versatile tool. I will give this back to Tyler.
Thanks, Carolyn. That's awesome. That's a really great overview of those two resources. And I've got just a couple more that I'll share here towards the end. And then Rama asked about suggestions for kind of training and getting started with some of this. So we'll cover that as well. And then we'll still have a few minutes for questions. So just a couple of additional data sources. So the COVID data has come up a couple of times. If you're interested in working directly with some of the COVID data, the Johns Hopkins and the New York Times have both been sharing their daily COVID updates on GitHub. So that's a possibility if you want that data. There's a few sources here as well. So the CDC GIS and public health website is kind of interesting to look around in because it's just a website, but it is a bit of a repository. So it kind of has different sections within the site. And there's information and data and resources around public health data, geographic data itself. So things like boundary files and population data, data around social determinants of health and environmental health data. So it may not be your first place to go to look for actual data sets, but there are many there, and it kind of gives you an idea of some else of what's possible. The American Community Survey, we've talked about a couple of times, it's come up today. A lot of that data is in Social Explorer, which is the first tool that Carolyn showed. And this is the data that used to be available through American Fact Finder, and now it's at data.census.gov. Which is a better interface to use. And it's if you want to just go in and start downloading bunches of data, then that may be a little easier than working in Social Explorer, although maybe not. So just another thing to be aware of, you may see around, and there is some duplication. That is a lot of the same data that we looked at from a different source earlier. But it's worth mentioning the American Community Survey has quite a bit of healthcare related data. It has data for things like insurance coverage. You can get county level insurance coverage and populations that are eligible for insurance coverage and lots of sort of healthcare services type data like that. And Carolyn confirms that downloading in Social Explorer is harder than the American Community Survey. So that's good to know. And then the last one on this list, global burden of disease. If you're interested in global issues, it's a really interactive and rich, sort of data source and set of visualizations and maps and presentations and data. It comes out I think it comes out every 2 years. And so if you go to the content itself, you'll see there are lots of different ways to explore it right on the website, which I won't go to now, but there are maps, and the image that we see on the slide here is actually from Global Burden of Disease. And you can see on the left, there are lots of different filters and ways that you can sort of slice and dice the data that you want and then see it displayed in a map or other visualizations as well. And it's relatively easy to download data from this interface too. So if you're interested in things like infectious disease incidents, chronic disease, cause of death for by country and by condition globally, then that's a really good source to be aware of. And finally, if you're looking to do some more sorry, will help if I change the slide. If you're looking to do some more of your own training and kind of learning in this area, we have a few resources here, and then there are a couple of others that I will just mention. But if you're working on a project and needs some help more immediately, then there's a link on this slide to set up a consultation through Clark Library, which again is where Carolyn is. And that's a great way to get help for what it is you need in the moment. If you are interested in sort of learning longer term, maybe you don't have an immediate project need, but you want to start building these skills, the research guides that are linked on this top bullet point, that's a set of websites that the Clark Library maintains that will point you to several different resources for starting to learn how to do this for yourself a little bit. And some of the resources on that guide point to the Esri training resources. So the third bullet point there, if you're interested in using any of the Esri products, then Esri really has a lot of robust training content. That's a really good place to start with those tools. Midas and CSCAR hold open workshops. I know within the last semester or so, there have been workshops on QGIS, on mapping with R, and they tend to have one or two a semester, it seems like, maybe more. So those are a good place to keep an eye out. Also, not on the slide, but another thing to keep in mind is looking at Coursera.org or LinkedIn Learning, which previously was lynda.com. LinkedIn Learning and Coursera both have some good GIS training there as well. And they have sort of the specialized, like the specialties you can do that are 3 or 4 courses as a package, or you can just do individual courses. And I've done a little bit of work with the one offered by the University of Toronto. I think it's called Introduction to Geospatial Data or something like that. It's the University of Toronto. And that's been a good one for me to start with, having very little experience before. And then if you're currently in a graduate program at U of M, there is a graduate spatial analysis certificate that you can pursue along with your degree. And I don't have an exact link here, but if you Google UMich spatial analysis certificate, you'll find that pretty easily. So something else to keep in mind. And with that is the content that we had for today. So we're happy to take questions. If you have questions in the future, feel free to email either one of us, and we will route you to the best person to help you out with your question related to geospatial data, GIS software. And thank you again for inviting us to come speak today.
Thank you guys so much for taking the time out to do this. I'm going to stop the chat, but if anyone stop the recording, but if anyone has any questions, please feel free.